Hi, I'm Joanne Silberner. I'm a freelance reporter and I also teach journalism at the University of Washington. I'm in Haiti right now on the third leg of a three-part trip to Haiti, Uganda, and India. I'm exploring issues of cancer in developing countries. And here's why. I believe that a lot of people think that cancer is a disease of rich countries and older people. That's not so. It's an enormous burden in developing countries where people don't have the resources or the knowledge of how to take care of cancer, or where there is the availability of cancer care, people can't get there and there's not enough of it. So I've seen that in visits to Uganda and India and Haiti. Each of these countries has a very different experience with cancer. But there's one thing that's true across the board, and that is for poor people, less educated people, they don't know to come in. And they're afraid of coming in, actually. In Uganda, I talked to a women's group, a women's breast cancer group, and the women in the group told me that their friends say, don't go in. Why should you go in for help if you have a lump? Because all they're going to do is cut off your breast and you're going to die anyway. So people wait to go in. And of course, the prophecy then becomes true, because if you wait that long, some of these women wait so long that the cancer's extruding through their breast. Then they come in and there is nothing that can be done. So you do die, and then it perpetuates the myth that all cancer is deadly. So education would do a lot, and some of these countries are working very hard to bring their folks up to speed on it, but it's a big job to take people from absolutely no awareness or total fear into a place where they can get care. And then there's a problem of getting to the care. For some of the people I talked to in Uganda, it was a 12-hour bus ride that they couldn't afford. And if you need chemotherapy every 2 weeks, and you've got this 12-hour bus ride in front of you and you can't afford it, you don't go. And there are a lot of people who died there because of that. And the availability of care is a big issue as well. One of the people I interviewed in Uganda was the only oncologist in a country of 30 million people up until just a few years ago. So obviously, not everybody in Uganda with cancer can see this guy. Most people didn't even know he existed. So I'm going to be telling these and other stories about patients, about caregivers, about efforts to give care. Right here in Haiti, we're going to be looking at efforts to give care in a primary situation. And I hope you'll listen, because I know I've learned a lot in reporting. Thank you.